Hello, everyone, and welcome. We're so glad you're here today to hear this wonderful training on building financial resilience in the LGBTQ community. My name is Rita Wolfson. I am the founder of Financial Social Work. With us today is Linda Benjamin, our relationship manager. She will be working with us also, and you'll see that in a little while. And Eric Sock is all things digital and technical, and I'm particularly happy to have him with us, just in case we have any digital or technical problems. Our guest speaker is Paul Wierzbicki, and Paul is a really favorite presenter and trainer for us. He's done several, and each one is better than the last. And I think you'll find this to be true today. And Paul will tell you all about himself when I turn it over to him. But before I do that, let me tell you a little bit about some housekeeping things here. So you can check probably the question box, not to chat box for messages. We don't share slides, they are proprietary. However, you will get the recording and it will be up on our Facebook page, YouTube channel within a few days, and we will be emailing it to you. You can type your questions into the question box and we'll answer as many as time permits at the end. There is no CE for this webinar. And if you have any technical issues, this link is probably in the question box, so that's where you go if you have any technical problems. So keep going. Stay tuned. At the end of the training, we have a special discount we offer only to those who attended this training. I like to begin with our financial social work affirmation because I think it truly captures the work of the essence, really, of what financial social work is. It goes, just for today, I will love myself enough to face my fears, practice self-acceptance, and embrace hope. I will silence my inner critic, speak my truth, and make peace with myself and with my past. Just for today, I will give myself permission to eliminate toxic people, beliefs, and behaviors from my life. And just for today, I will prepare for a better tomorrow by healing my relationship with my money and with myself today. So this year, we've been starting our trainings with a graphic, and we ask you to tell us, this is the audience participation piece, we ask you to tell us what this graphic means to you, what it brings up for you, what it makes you think about. And Linda will be sharing your thoughts. So go ahead and put them in the Q&A box and she'll share them with the audience, with everybody else.
What's your first reaction? What do you think? In the question box. Mind on my money and my money on my mind. Money always on your mind. Troubles with money. Again, money on my mind. Money takes up a lot of space in my brain. Always consumed with thoughts about finances, anxiety, confusion over money. This is interesting. Money controlling our thoughts. Money consumes our existence. Several money on my mind, and lots to do with taking up space, rent-free space in brains and minds.
I love when we do this. It's so fascinating to hear everybody's thoughts. For me, it really captures the piece of money and mental health. We have to stay aware of how these impact each other. The connection between money and mental health is very real and can be very problematic. Any final thoughts from anyone, Lee?
Money consumes all, that's in capital letters, areas of the brain. So
True.
that's it's all about mental health and money.
Yeah. And financial problems, stress, anxiety, all of those things affect us physically, mentally, emotionally in so many ways. And Paul will be talking some about that in a little while too. Thanks, everybody. So to get started, for those of you who are new to financial social work, I just like to spend a few minutes explaining who we are, what we do, and why we have done a free monthly webinar. And you can see all those recordings on our website when we've done them for over a decade. So financial social work, it's a behavioral model. We address the thoughts, feelings, attitudes, beliefs, values, and experiences. That's where financial behavior begins. And until and unless behavior changes, nothing changes. It's our financial behavior that drives how we earn, spend, save, share, and borrow. Money's complicated. Life is complicated. We all know there's no one or easy solution or fix for either. But what we try to do is to simplify this, to reduce those overwhelming feelings of stress, shame, trauma. That's what complicates life, money, and mental health. It's about healing your relationship with your money and yourself, growing more successful personally, financially, and professionally, taking control of your money to gain control of your life, making peace. It's very important, making peace and healing your relationship with your money and with yourself, understanding there's always hope, setting personal and financial boundaries, reducing the stress, problems, anxiety that I just talked about, creating a safe, non-judgmental space to learn, process, and talk about money. It is all about financial behavioral change, and it is very heart-centered, approaching money and life from a perspective of healing, acceptance, courage, wellness, transparency, and honesty. And you will see all of that as foundational to what Paul will be training us on today. So we are at the intersection of social work, politics, the economy, gender, racial, social, economic, clients, and other able justice. Our work is engaging, motivational, strength-based, hopeful, and positive. You see all of the various pieces that we bring together to make the approach successful and to help clients take control of their money and gain control of their lives. It all starts with the individual, it expands to the family, it certainly stretches to the social environment, into the workplace, and into the community. We have thousands of graduates across the country and around the world. And Paul is one of our finest. This final simple truth before I turn this over to Paul is that no one chooses to have money problems, but most people do. And that's why there's so many Americans in need of financial social work. So what they need is a trustworthy, reliable professionals with whom to process all things monetary, a safe, non-judgmental space where they may talk and learn about money, because everyone needs someone and somewhere to share their money secrets and questions that they've been hiding from or avoiding all of their lives. And now it gives me great pleasure to turn you over to your trainer for today. Paul, I am turning it over to you right now.
Thank you, Rita. Can you hear me all right?
Yes.
Okay, fantastic. You can see my screen, the PowerPoint, correct?
Perfect.
Yes.
Beautiful.
Fantastic. All right. Well, thank you so much, Rita, for having me here. Good afternoon, everyone. Thank you for joining us today. As Rita said, my name is Paul Wiersbicki, and I am a licensed social worker in the state of Michigan and a financial social work graduate. So today we're going to be talking about how to build resilience in the LGBT community. Um, we're going to be talking about some financial principles that you should probably know to incorporate financial and behavioral change. Talking about employment and income and some of the barriers that queer people face. Some legal considerations generally and apply to money and income, healthcare needs and finances, and then finally rounding it out with building resilience and sustainability in the community. So a couple of acknowledgments before we get started. Thank you, Rita and the Center, for having me back again. I'd like to thank my husband for continuing to take care of me. I continue to fight for equality and do social work things. And to those who have fought so that I can be here, and those who may no longer be with us due to homophobia, transphobia, HIV, and other types of oppression. So let's get started with the state of affairs. LGBT people consistently face higher rates of poverty, food insecurity, unemployment, and job discrimination, among other disparities. And these disparities are often even worse for transgender people and queer people of color. Some of these specific things are low pay. According to the LGBT Economic and Financial Survey, or LEAF survey of 2023, the LGBT population reports lower overall income than our heterosexual counterparts, with as much as 57, that's over half of people declaring an income of $50,000 or less a year. This is contrasted in the survey to about 36% of heterosexual people saying they make 50,000 or less. Additionally, there are lack of legal protections, which this was a little bit more salient before things like marriage equality in the mid 2010s, but nevertheless, LGBT people report experiences such as being denied joint access to a bank account with their same-sex partner. We can find that there are higher interest rates or costs over the lifetime of the loan due to various factors. And for our trans people, they may be denied updates to their name on their banking documents, um, which can have serious ramifications. Oftentimes, LGBT people face increased healthcare costs due to medications that they may need, perceived or actual risk of behaviors in the way of higher premiums, or healthcare organizations not covering required medication, such as PrEP, or if they do cover some of these services, medications, or like gender transitioning services, they gatekeep them in a way that's not accessible. In addition, LGBT people face challenges of losing access to their family, regardless of whether it's due to them being cut off from the family, or being disowned for their queer identities. They can really place them at square one, and it really disenfranchises them from their support network and things such as generational wealth are applicable. So as you can see, there are a lot of barriers that queer people face regarding financial health and wellness. However, we'll cover some of these strategies and ways to help foster resilience and overcome some of these barriers. So let's talk about some financial principles here. Um, so a very important person to me, Rita always says that we don't have to know everything about money, but there are some things that we should know about money. And I've outlined four concepts here for this webinar. So first, let's talk about understanding your money and your needs. The foundation of any financial plan starts with knowing exactly where your money is going and coming from. This means tracking your income and expenses quite meticulous. In the hand that there are some apps that I have included, some of them Empower, Monarch Money, YNAB, You Need a Budget, Rocket Money, and so forth. Um, these can be helpful to understand your needs and where your income is going, um, and let you know what types of things you might need to work on. However, um, if you feel like you want more control, there's always the good old Google Sheets or Microsoft Excel. And in the handout, I have a video that teaches you how to do a simple budget. Um, being able to know and understand your needs is super important to our next step, which would be setting goals. Um, set goals, so we need to be able to prioritize the essentials. A lot of times it's housing, groceries, utilities, so that way if we need to make any hard decisions, we know the ramifications of that. So once we have a clear of our financial situation, setting goals becomes much easier. Where possible, setting SMART goals, that is specific, measurable, achievable, relevant, and time-bound goals, are critical. These types of goals are clear and reachable, which can help you maintain motivation and staying focused. So, for example, after you are done budgeting, you find that you might have a small amount of money left over, and you become rather painfully aware that you don't actually have any emergency fund. So a short-term goal might be saving $50 a month for 3 months to build an emergency fund. This type of goal is specific, measurable, and achievable within a set time frame. You know, I also think it's important that we know that financial awareness is critical, but it can be important to not obsess over it. So becoming more uh, aware of financial terms and literacy, like understanding interest rates, how loans work, understanding that not all loans are created equal, and what the long-term ramifications are, can help you make better overall decisions in the long run. In addition, as Rita had said previously, part of understanding financial behavior is how we spend and borrow. And for better or for worse, credit is here to stay. And it's an important aspect of financial stability. Your credit score affects your ability to get loans, rent apartments, and even sometimes get jobs. You know, it's incredibly important to know how it works. And while that could be in itself its own webinar, I want to outline a couple of the factors that you may come across. Payment history is probably one of the biggest ones, making sure you pay your bills on time. How much of your utilization out of 100 is usually there. So you want to aim between 0 and 30% on average. The length of credit is important just because you have a lot of it. If it's new, a lot of lenders may not be comfortable with that. Again, new credit can look somewhat suspicious, but also having a good credit mix is important. Building credit can be tricky, especially if you have bad or no credit. Sometimes considering getting a secured credit card or credit builder loans, which oftentimes are more accessible, can be a really good option. Um, local credit unions and community development financial institutions can be a little bit easier than your traditional bank. Um, whatever option you or your clients use, Managing credit wisely can be a really important financial component for having better financial opportunities in the future. So I know that this can be painful, and it's important to acknowledge that even if you're doing the right things, there can be some systematic barriers that still make it hard to get ahead. So let's talk about employment. So part of your budgeting, maybe you might know that you have maybe just enough to get by, but not enough to save. You've cut everything that you need to, or that you can, but you still need more money. One way is to increase employment. Employment and income disparities are significant issues for queer folks. Knowing your rights is the first step to protecting yourself. There are federal protections under the Civil Rights Act that prohibit employment discrimination based on sexual orientation and gender identity, but they're not always accessible. And documenting any instances is absolutely critical because you can then bring those to lawyers and other legal professionals to help safeguard your job. Many protections that LGBT people enjoy are based on already established civil rights. However, there are quite a few that we still find ourselves lacking in. As social workers, we are called to advocate on a macro level as well as do casework. Two pieces of policy that I would like to call your attention to, the Equality Act and the Employment Non-Discrimination Act, are two pieces of legislation that are important to expanding LGBT protections in the workplace and as well as other freedoms. Some of the key points are extending for the Equality Act anti-discrimination protections to areas such as employment, housing, public accommodations, education, federally funded programs, and credit, which, as we've already established, are big systematic areas that LGBT people face discrimination, as well as switching to the Employment Non-Discrimination Act. Some of the highlights include including employers that have 15 or more employees, which includes federal, state, and local governments. And this is paramount because even though we do have some acts that apply to us, like the Family Medical Leave Act, which if LGBT people may face higher mental health crises or physical health crises due to oppression, they only apply to businesses that have 50 or more employees. So expanding these protections is absolutely paramount to the health and sustainability of our community. So, as I said before, documenting instances is super important, and then contacting LGBT-friendly legal organizations can be your next step. So when we are searching for employers who may be more inclusive, to deal with the problem is to prevent it, using some of the knowledge from maybe LGBT community centers or other people in the community can be helpful to avoiding this altogether. Word of mouth and mutual aid groups can also be effective if you can't find anything else. However, there is one resource I'd like to draw your attention to, and that's the Human Rights Council's Corporate Equality Index. They rate businesses on, sorry, they rate businesses on non-discrimination policies across all their entities, equitable benefits for LGBT workers and their families, inclusive culture, and social responsibility. So these are covered in the handout. These are some resources to navigate the employment legal kind of landscape. There's Lakeshore Legal Aid, your state's local legal help page, as well as most lawyers will offer a free consultation. If you need help finding a lawyer, the LGBTQ Bar Association is a really good um, legal resource to find queer aligned lawyers in the area, as well as the National Center for Trans Equality Network. They have a directory as well. So, in terms of navigating some pay inequalities, we want to focus on uh, skill acquisition and being able to get paid what you're worth. One great resource that I want to talk about is ONET. It's Occupation Net. It has a lot of great resources to skills you might need. It has a section to find certificates and degrees in your area. It has research data for salaries, and it's all free, and it's at onetonline.org. If you need a little bit more help, there are vocational rehabilitation agencies or workforce development agencies that may be help that could provide some help financially covering the cost of certs and programs. They also usually have relationships with employers, and they can help with advocacy, whether it's knowing your rights or other um, other sorts of needs you might have. So I have a question here for a little bit of participation about managing healthcare costs. If you could take a minute, which of the following best describes an out-of-pocket max?
Paul,
Go
Paul, do
ahead
you want
and,
me to launch the poll?
huh?
Do you want me to launch the poll?
Yeah,
Okay,
triple click, please.
there you go.
Thank you, Rita. Sorry. It looks like we have a good mix of answers coming in.
We do. We do. We have about 50% of people have voted. So
Yeah.
we'll give it a few more seconds. If you want to vote, go ahead. I'll count it down, Paul. It's 5, 4. Gonna close it. 3, 2, 1. I'll close it and I'll share the results. And you can comment on it, Paul.
Sure. All righty. So I just really want to call out the 6% that are really honest. I feel you guys. But it looks like 9% said the maximum you have to pay to have your health insurance. That's actually not it. That would be your premium. 8% say that it's a maximum benefit that your plan will cover in a year. Not quite. And indeed, deductible you must meet before your plan starts to pay for covered services. Uh, B is just the deductible. The correct answer is B. The maximum you'll have to pay for covered services in a plan year. Other than that, as you'll see on the next slide, we'll get into it.
Okay, I'll
But
close it,
thank you.
Paul.
And most of you got that right. I am really proud of you guys. So queer people face a number of health care related challenges, including gender affirming care, mental health, and substance use disorders, which are disproportionately high to the general population. Some sobering facts that are worth mentioning, but we don't necessarily have time to get into, is that it's estimated that for the community annually, these additional healthcare costs total between 25,000 and 75,000. And what's worse is that some insurances don't believe that transitioning is medically necessary. As a clinical social worker, this is I disagree. This is clearly suicide prevention. But according to the Center for LGBT Economic Advancements and Research, There's a quarter of our community who do receive gender affirming care, but it can cost up to $20,000 or more just out of pocket. Which brings me to my next point. This point is insurance is absolutely needlessly complex, but it is important to have knowledge of it. Knowledge is its power, and when it comes to navigating, you need to know what you're doing. So what's most important is understanding your plan and what it covers and how it covers it. You can do this by requesting a summary of benefits from your workplace or sometimes from the insurance itself. Really important here, though, that this only applies to commercial insurance. If we're talking about Medicaid, we would need another webinar. So two terms here, deductible is the most you have to pay before, or an amount you have to pay up to before your plan even starts to pay. Generally, you're responsible for 100% of the cost up to this point. Now, I know what you're going to say, but Paul, when I go to the doctor, when I take my kids to the doctor for my physical, they don't charge me anything. Or maybe it's only $25. And that's a good point, which is why I say knowing your plan is important. Many insurances, though not all, will cover some services before you reach your deductible. They may use language such as deductible does not apply or covered before deductible. This can apply to a variety of services, whether it be office visits, substance use counseling, mental health visits, imaging labs. When I say know your plan, this is what I mean. Become very familiar with it. For queer people, this could look like knowing what your lab costs are, because you're going to need to be getting labs every 3 months, STI screening, maybe labs for hormones, for HRT, which all affect your bottom line. Going back to our first principle is knowing and understanding your needs. So then, as I was talking about earlier, the out-of-pocket max, the out-of-pocket max is generally, this is the most amount in a single plan year that you will pay for any in-network covered services. Then after that, the plan will cover 100% of covered costs by itself. So you might see that your out-of-pocket max is like $7,000. After you've paid that $7,000, including your deductible, your plan should cover all of the costs 100% for covered services. What this looks like for LGBT or trans people, if you are paying for medication and your prescription deductible is included in your medical plan and you don't have it through another company, your prescription should be covered 100%. This also includes gender services, whether it be HRT or gender affirming surgery, like top or bottom surgeries. This is really, really important to planning your life, but also your budget. So some other things, I covered these in the handout, so I won't spend too much time on them. Exploring public benefits, so your local Medicaid, your DHS office for people who qualify, but of course Medicaid is for low income, or disproportionately, queer people face higher rates of HIV. So finding out your local Ryan White services, like a community-based organization, can help. One thing for our people in Michigan, the Michigan Drug Assistance Program has a program called Premium Assistance, where if you have a premium for your health care, a lot of times through the ACA, they may actually pay for you to have that health care, so that way you can engage in care to become virally depressed. Another really quick thing that I think we should talk about is manufacturer's coupons for prescription medications. Oftentimes, if you have a chronic health condition that can affect your budget, and it's not covered super well, thinking about Ozempic and like Mounjaro for diabetics, you might be covered at a 50% co-insurance, which means you pay 50% of whatever price that they have, that can still be a lot of money. So searching for some manufacturer coupons can help drastically reduce it. I think under my insurance it was 25 for 30-day supply, and then when I was able to use a manufacturer coupon, it went down to 25 or like $30, which is a significant savings. But that only is for medication, not necessarily for seeing a provider. Inquiring about sliding scales for providers' offices can be a good way to get care while still looking out for your budget, as well as GoodRx, which is not an insurance, but oftentimes if you present them with the code, it can give you a pretty nice discount, although not always. So definitely just try it and see where it goes. So then coming into the home stretch here, focusing on building financial stability and resilience. Okay. Building financial stability involves increasing financial literacy, working with financial planners or particularly financial social workers, can help you navigate the financial system and empower you with knowledge. Up until this point, we've been talking a lot of micro things that you can do like in day-to-day life, but if you're looking for more of a comprehensive approach to longer-term projects, these professionals can provide both financial and emotional support, helping you make informed decisions and build a more secure financial future. As well as we were talking about earlier, generational wealth. There are a lot of ways that we can navigate this. Just because family legally tends to come first doesn't mean that we can't use our chosen family through lawyers, wills, estates, end-of-life privileges, and mutual aid to ensure that although our path might look different, it doesn't have to lead to disenfranchisement. Other things that we can do to pull it together in building sustainability and resilience is focusing on mental health care. Financial stress can significantly impact our mental health. If this presentation has caused any anxiety or depression, you are not alone. Working with a therapist can help you address these feelings and empower you to take control of your emotions. Mental health support is a critical component of overall financial resilience. If you are not able to, there are some self-help books or self-care books that come to mind. Mind Over Mood is something that they use with us in grad school, which is a fantastic resource about gaining control of your thoughts. If you are able to access insurance and have the idea that therapy might be helpful, Psychology Today or word of mouth referrals for queer providers is really, really helpful. And psychiatric care, if you feel like it's needed. We don't always have to take medication if we don't want to, but it can be a fairly salient part of the system. And finally, advocating and community involvement are powerful tools. I would suggest, if possible, joining organizations like Fight for 15, writing to your elected officials, and joining or forming unions if possible. Other types of advocacy that you can engage in is starting or joining your LGBT Chamber of Commerce and recognizing that together we can create systematic change and improve the collective financial stability of the community. Advocacy isn't just about improving our own situation. It's about creating a better environment for everyone. Remember that together we are stronger. Alone, it might feel like we can't do much, but together we can achieve more than the sum of our parts. Advocacy and community involvement are about harnessing the collective strength to fight for a fairer, more inclusive society. Let's work together to create systematic change and improve collective ability for the queer community. Before I go, I'd like to leave you with a quote. Caring for myself is not self-indulgence. It is self-preservation. And that is an act of political warfare. And that's by Audre Lorde. So that is it for my presentation. I would like to know, do we have any questions?
Paul, we're going to go ahead and finish up, and I'm going to do a few slides before we take the questions. Did you have another slide?
Okay.
Are you finished?
Yep.
Well,
I
thank
am
you,
finished.
Paul.
Thank you, Rita.
Let me take the presentation back. Okay. Going to show my screen, and we will finish up. So before we do Q&A, a few things I like to point out is that no one chooses to have money problems, but most people do. And Paul referred to this. I talk about the fact that no one can or needs to know everything about money, but everyone needs to know certain things about money. If we want to build financial literacy for future generations, we have to teach youth today more about money and not just budgets. We have to go beyond dollars, cents, budgets, math, and debt. And that's what financial social work is about. We need to stay aware of the connection between money and mental health. It's very strong and it needs to be addressed. There exists too strong a relationship between finances and suicide. That should not and doesn't have to be a death sentence. Always choose life. Everyone has a relationship with money and with themselves, and most need healed. Healing your relationship with yourself takes time, honesty, less self criticism, and more self love. And healing your relationship with money begins with that psychosocial component of thoughts, feelings, attitudes, and beliefs. When we talk about money, we talk about power because those who have the money have the power. So those are my closing thoughts. And I'm about to tell you that we have a few other resources before I give you your discount code. I want you to know that next month's free webinar is about using financial wellness circles to heal money wounds. And our August webinar is a complete update from the educational director at Experian, who will teach us about new credit scoring changes in 2024. You should also know that we have a client financial wellness magazine that can be used in multiple ways. That information is on our website. You can also be listed in our financial social work directory, and that is a lifetime listing for $99. And we have a partner program that if you refer someone, they receive a 10% discount and you receive a 10% commission. And we have social workers earning hundreds of dollars from our partner program. Finally, we have the Financial Social Work Collaborative. And these are a group of wonderful women who are graduates and are committed to spreading the word about financial social work. I have this here that shows that each month they have 4 different events. And I gave you the date of June 28th. That's the last event this month, and they will be talking about financial trauma to the same community we've been learning about today. I want you to know that we have a certification that I've talked about off and on this afternoon, and it includes 20 CEUs from National NASW. But for those of you who attended today, we are offering you 15% off, not only of our certification, but everything else that we have on the website. That code is webinar 2024-06, and it is good through midnight this Monday, the 17th. So here we are. We also have a handout. So if you go to that rectangular box, you should see a link and you can click on handout, which isn't just beautiful, but it has all of the information Paul just shared with you. So Linda, do we have questions?
We have several questions. Well, first of all, I'd like to say thank you, Paul, on behalf of everybody for this webinar, which was truly rich with resources and information. And I just have to share a comment that just came in. So I'm just going to go rogue here. One of our attendees has written, as an LGBTQ member myself, as well as a social work practitioner, your attention to this and the acknowledgement at the beginning has brought tears to my eyes. Thank you so much. So
Wow.
that's really, Paul, you really need to internalize that. So thank you for the comment.
Thank you.
This was really a presentation rich with resources, and a lot of our questions have to do with more resources. So Paul, one of the questions is, what resources might you suggest if someone believes they received biased medical care passed out given their gender identification?
Yes, I see. If someone's receiving biased care due to their gender identity, I would recommend a couple things. One, if there's been like perhaps any harm, talk to a lawyer. As a practicing therapist, I have to carry malpractice insurance. Like that's first and foremost. If you feel like fighting. Number two, you're always entitled to a second opinion. A lot of the LGBT community centers may have LGBT focused health centers or federal qualified health centers, FQHCs, that can receive grant funding. So theoretically, they shouldn't be biased. So if possible, get a second opinion and leave that provider in the dust with respect.
Okay, thank you. Next question. Again, we're reaching into your pocket for resources. Do you have suggestions on books or podcasts we might be able to share with our clients on this topic?
There is a lot, almost too much to name. Are we talking about, well, I guess if they could provide a little bit more like financially, like advocacy wise, like, because there's a lot of queer literature that I can recommend, but it's a tad bit dry.
Yeah, is there something in particular that you refer to, or that you, financial trauma and how to address it is the clarification on the question.
Yeah, there is, so as a therapist, I really focus from a CBT standpoint. There is LGBT affirmative CBT, which is like a provider manual that I think is really good for addressing a lot of the queer related stress. I think that it's kind of like an integrated, almost like an eclectic approach. I would highly recommend going through a lot of the financial social work resources that Rita has and being able to pull it together in a way that makes sense.
Okay, good. Thank you. Another question. What advocacy organizations are you involved with, and how have they impacted your financial stability?
Well, a lot of the LGBT community organizations that I've been involved with generally pertain to me being a therapist. And as a licensed social worker, they tend to impact me fairly positively. But there's a couple of things that I have in the works, but a lot of them tend to be focused on like less financial, more healthcare as a therapist. But some of those would be for me locally, Affirmations Community Center and Stand with Trans organization.
Okay, thank you. And thank you from the folks who are sending in questions that you are so willing to answer. Can you share any success stories of how community involvement has helped you or others in the LGBT community achieve financial stability?
Yeah, I think part of my success story comes from being able to rely on people. For me, a lot of my story revolves around education in school and being able to borrow, to complete my degree with a big like part of community support for me. Um, but that is that's a really good big question.
Another big question here. What about youth whose family has turned their back on them because they've come out, or who plan to and have to prepare for life on their own at a young age?
Yeah. So there's a locally for me, I would say that I'd recommend them to get in contact with their local LGBT centers. There tends to be two big areas where we see a lot of resources, and that's LGBT youth, specifically for the problem that you just said, that they get cut off, and seniors. Adults are kind of in the gap here, but I would absolutely recommend, like if they're able to, engaging with a therapist because there's a lot of trauma that comes with that. Um, a lot of shame and guilt that might be present. So I would also recommend um, understanding your needs from more of a mental health aspect, and then kind of pre-planning. I would love for you to have all these resources and not need to use them because you come out and it might not go perfectly, but it goes all right, than to think it's going to go really well and need the resources that you don't have. So it can kind of feel like you're doing things behind people's back, but um, as Audre Lorde said, like self-preservation is not indulgence, and you have to do what you have to survive.
Okay, thank you. Um, Legal rights in the workplace is a question.
Mhm.
And specifically, what resources help you most in understanding your legal rights in the workplace?
I think a lot of community-based organizations are going to be able to do a lot of outreach at Pride festivals, particularly for this month. Um, knowing what uh, what things are out, what resources are out there, um, and listening to your intuition. If it feels wrong, investigate it. I would recommend, again, the LGBT Bar Association. Um, and without going out of the scope of my practice, like some things that feel wrong might not be, and other things that may not be wrong are actually wrong. So um, if you feel like there is something like specifically to employment, I would recommend like a workforce development agency. For me, it's Michigan Works or like vocational rehabilitation agency. Because although it's not one in one, if someone's discriminating based on LGBT identity, there may be things like a disability that's also accompanied with it that could be substantiated a little bit easier.
Okay, thank you. I think we have time to squeeze in another question. Talking about managing mental health, how do you manage the stress and anxiety that can come with financial challenges? Are there any mental health resources you can recommend?
Full disclosure, I'm biased here, but therapy is a really good resource. But if you don't have the time or there's stigma associated with that, support groups, webinars like this, I would recommend knowing exactly what it is that is causing you stress and then focusing on that if you're able. Because I could bore you all day with credit tips, but if it's not credit that's your problem, it might be like family boundaries and someone taking money, then that's not going to be helpful. So it's kind of like a 2,000 calories rule. Like it's general advice, but like that might not fit for everyone.
Okay,
I
thank you.
can see that so many people have stayed with us right up to the end. I thought it was wonderful. I hope everybody that you took the handout, be sure to grab that handout because it has all the information Paul shared with you. Paul, thank you, thank you, thank you. And everyone, I hope to see you back here next month for our next free monthly webinar. Have a beautiful rest of the day. Watch for the video if you want to review it. Bye now.
Thank you. Bye-bye.